Hey, Dr. Henry here again. I wanted to tell you a little bit about something that we call the Austin Knee Clinic. So the Austin Knee Clinic is actually inside Techstar Chiropractic, and what it is it's our specialty practice focused exclusively on knees. We opened it about 2 years ago, and what we've really done is gone above and beyond to try to find some alternatives for traditional knee care. We have brought in some specialized equipment, done some specialized training, and I'm going to tell you a little bit more about that later on. So we originally started the Austin Knee Clinic because we saw that there was a lack of non-surgical, non-injectable, and pharmaceutical knee care available. And what I mean by that is that traditionally when you have knee pain and you go to an orthopedist, if you have degeneration in that knee joint, then you're recommended either a steroid injection, sometimes a hyaline cartilage injection, or knee replacement. Those are kind of your options. There's physical therapy as well, and we do a little bit more of that, but generally it's going to be medication or a surgical or injectable fix. And the success rate with those isn't fantastic. So what we wanted to look at is, hey, what about these other people? These people that maybe aren't ready for surgery yet, but still have knee pain that's chronic and debilitating. So what we wanted to do was to come up with some ways that we could approach that kind of care. So we dug deep into some knee training and did some extra learning basically on, hey, what are some knee conditions that respond really well to non-surgical care? And when we got into it, it's the majority of knee conditions. Honestly, until a knee is just so degenerative that it can't be saved, then surgery should be our last option whenever possible, aside from trauma and things like that. I'll show you a little bit what I mean. So this is a knee joint. This is a deeper view. This has just the bones, the ligaments, and the cartilage. And what you've got are these ligaments that run up either side, and then an ACL and a PCL, and those are what stabilize the knee front to back. Now, if you tear one of these ligaments completely, that's a surgical situation. But say you just have some damage to one of these ligaments and we need to strengthen the muscle tissue around them. That's where physical therapy and chiropractic and conservative care like we come in and provide. The other thing we see a lot of, and this is probably the vast majority of knee pain patients that we see, is pain along the inside of the knee or along the muscles in the leg around the knee. It's not actually knee joint pain. And there's a big issue with differentiating that, because if you can restore the normal balance of the muscle tissue around here, you can go in and release the over-tightness, the inflammation, these tendons, and the knee pain resolves itself relatively quickly. So you can save a lot of people from ending up getting surgery, because if you have degeneration and you have this, well, the main approach is going to be to go in and replace the knee or resurface the knee, and a lot of these folks end up not needing to do that at all. So that's what's really kind of exciting about what we're doing here at the Austin Knee Clinic. So I just wanted to tell you a little bit about kind of our approach. We're here to try to provide options that are non-surgical, and we have a really high success rate with that. We try to really dig down to the root cause. So if you're having muscle imbalances that come in because your hips are offline and you're walking on sideways and there's something wrong with your feet and ankles, so we kind of evaluate the whole lower half of your body whenever we treat a knee pain patient, as opposed to just zeroing in right on the knee, because I think you miss a lot of other things going on when you get so focused on one area that's painful. So we try to take a whole body approach, really go and dig in and figure out what's causing the problem and the pain. And then when we do have degenerative issues like that, we do have some therapies here in the office that we'll have several videos coming out later this month that'll kind of go over the different therapies we use to treat degenerative conditions non-surgically.